This is a view, of course, of the Methodist Medical Center, taken, I guess, how you would see if you came in by helicopter, the location of the St. Jude affiliate.
And this is a clinic day with Mom and kids coming to pay their weekly visit at St. Jude. This is a playroom, the most popular room in the whole clinic. Seated right in front of it is Linda, our new play coordinator, and this is Tim. You'll be meeting Tim later.
A fellow with a lot of courage, as you'll find out.
This is Tim's brother, Andy.
Andy's been a great inspiration to his brother, too.
And this young lady's name is Andrea, and she really likes to color.
She has quite a personality.
That was the wrong color. This is Jamie.
What do you write? Huh?
And here's Dr. Hart with Matthew.
Okay, very good.
Part of the examination process that children undergo during clinic day.
Really fits his thumb, doesn't it? This is a lady of St. Jude waiting to take a prescription to the pharmacy.
We depend heavily on the volunteers.
That's right. That's Mary Gramlich.
It's going to be cold.
So this is a scene that really shows what the kids undergo. This is a bone marrow, and you may want to look away briefly during this procedure. We want you to see what the children experience.
And it isn't just a one, it happens many times. Dr. Anderson, Joanne Johnson, our head nurse, and Tim's mom is there to assist and to help.
The next test is for spinal fluid.
All we got to do is just undrip you now.
We're happy to report to you that bone marrow test turned out exactly the way we wanted it to. Tim had no signs of leukemia cells.
Isn't that courage, ladies and gentlemen? Those are diagnostic tests that must be done. And as part of the diagnostic procedure, they do take blood samples. We didn't show you that as one of the tests. But they take the blood sample, and it is tested on this, which is a Coulter counter. And in 40 seconds, it provides 7 different tests. Previously, before the $65,000 machine was acquired, it would take 20 to 30 minutes for the 7 tests. Judy Sutherland, we just saw Jane Nassaker, medical technologist. This is Judy Sutherland. She, too, is a medical technologist, and she's working now with a cytocentrifuge, which takes that spinal fluid and spins it down. I want to point out the cytocentrifuge was donated to St. Jude by the B'nai B'rith women in memory of Geraldine Bork. Now, the purpose of spinning this down is to get the fluid at high speed in order to concentrate all of the cells in a few ounces in an area less than a quarter of an inch in diameter on a glass slide, as this shows. This way they can better identify the cells.
Dr. Hart, on a typical clinic day, talking to Memphis. We don't have a direct line, but we make many calls. This is John Marshall in the pharmacy. He is the man who prepares the drugs that the children receive.
The noise you hear is from a laminar airflow hood, and that makes the air sterile while he's preparing the drug, which will be administered to Tim in a few minutes. Here you see a picture of John, our pharmacist.
All those drugs are provided by Memphis for the children, and They are used with the protocol that the child happens to be on. The protocol is the manner of treatment.
As you can see, this is a very precise procedure. These are very powerful drugs designed to kill the cancer cells, and it is important to note that in addition to killing cancer cells, they sometimes kill normal cells. So it is extremely important that the development of the drug is done very precisely. This is where they're administering it.
That's right. There's Tim, who waved at you a few minutes ago, and Sue Meismer, our nurse, who is there with him.
All of the patients, or at least most of the patients, are treated on an outpatient basis at St. Jude, but occasionally there is cause to hospitalize the child, and this gives you a view of the new pediatric department at the Methodist Medical Center, the centralized playroom, and the patient rooms.
These are some of our favorite people, our ladies of St. Jude, who are there for every clinic visit. We're always very proud of the fact that we have volunteer fundraisers, and this has to be the #1 volunteer fundraiser, Joanne Carter. Dorothy Klaus, who does all of our medical dictation. Connie Trunk is our bookkeeper, and there she's working on patient statistics. Alice Speller is the one who answers all the contributions that you send in.
There's a map showing where our patients reside, Marge, all over central Illinois.
The pins we like the best are the white ones. Those are for the 40 kids who are off of all therapy. We'd like to see the whole map covered with white pins.
And that's a view of a typical clinic day at the St. Jude Midwest affiliate, located at the Methodist Medical Center.